Hi, Dr. Blumberg. So it's great to see so many exciting advances for head and neck cancer patients who are getting surgery. As a surgeon, what is your role in discussing these changes with your patients? Is there a specific agent or treatment strategy that you prefer?
Yeah, it's a good question and something that is often on the minds of surgical oncologists is that our role has changed in the past probably 10 years where we have to have a lot better understanding of these systemic agents in order to have meaningful conversations with our patients. So, um, you know, I think my role is to, sort of help with expectations and how these different agents are going to impact their surgery. As it was sort of alluded to earlier with Dr. Trivedi, is that sometimes we look for these agents to shrink the tumor or make it quote unquote more resectable. And so it's important to sort of communicate what that actually means, how that may or may not change the surgery or the reconstruction, but also, explain that the neoadjuvant or induction therapies aren't just for that, but they're also to help with overall survival as part of a multidisciplinary approach to treating these complex cancers. Um, I do explain to them that it can change the quality of the tissues intraoperatively and sometimes make surgery a bit more challenging. Things can be a little bit quote unquote stickier, and make potentially put critical structures like nerves, arteries, and veins at a little bit more risk. But if performed at a cancer center, that should be pretty well mitigated by the skill of the surgeon. Um, and then also postoperatively, it changes things a bit. And then patients who've received either immuno or chemotherapy prior to surgery, we tend to watch them a little bit longer before we allow them to, say, resume taking a diet by mouth. We're not really sure about wound healing in these new treatments, and so we tend to be err on the side of caution because we want to make sure we don't develop something like a fistula where spit can leak out the neck, and make sure that we give the patients the best chance for a smooth and uneventful recovery.
Yeah, that's really great. Whoever said that surgeons only cut and don't think are wrong. And Dr. Blumberg, it's really important. I think as a field, we're approaching these therapies from a multidisciplinary approach, and all of us should be talking to our patients about the pros and cons. And I think as we move to the future, certainly highlighting that there could be a survival benefit is perhaps the most important, a reason why we should start integrating these therapies into our treatment modalities.